Hi, my name is Willie Fuller, and I'm a dental hygienist. I've been in practice for about 6 years, and Hygiene Edge contacted me several months ago hoping to make a video that goes over some really great yoga poses and stretches that are great for before and after our work days. I should preface this video by saying I'm not a yoga instructor and I'm not perfect at yoga by any means, but I have experienced my fair share of work-related injuries over the last several years, and as I started to incorporate some exercises and these yoga poses, it's really helped me be able to sustain the work that I do. A couple of the muscle groups that are really important to activate and stretch would be your hip flexor muscles, including your psoas muscle. It's the muscle that lines your spine from the inside, from your stomach side. And that muscle is something that we use more than your average person because that is the muscle that you use when you're sitting and twisting. And obviously we do that all day, every day. If we're trying to grab instruments here or there, if we're trying to stretch and see in a patient's mouth, it's just a muscle that we overuse and almost abuse. So in these yoga poses, I'll show you several different stretches that are really awesome for strengthening and stretching that muscle. There are a few things that are really awesome for opening your chest. Anytime that you're feeling like your shoulders are getting that rounded, just really simply take your arms out and stretch. A lot of times I like to find a wall, put my hand up against the wall and take a step forward and allow my arm to stretch back. And just that simple chest opening exercise, I can work for hours longer. I'll go through the rest in the video that I actually recorded several months ago. You'll notice that my hair's grown out quite a bit since I started making this video, but I hope you enjoy. I hope you learn a few bits and pieces that are worthwhile to incorporate into your daily routine, and more than anything, just keep you going, keep you happy in your career. Enjoy. Let's start by raising your hands up towards the ceiling in a stretch, and then lowering into forward fold, really reaching towards the ground and lengthening the back. Now let's raise halfway, bringing your back parallel to the floor in tabletop, lengthening the spine. And again, forward fold, a deeper stretch towards the feet, keeping your spine straight. Now we'll raise our hands back up and stretch towards the ceiling. Now we'll lunge into warrior two. Make sure your knee does not come over the tips of your front toes. And your back leg, the foot should be facing the wall parallel to you. Now we'll reverse your arms into reverse warrior, stretching up towards the ceiling, and rotate your arms forward into a triangle pose, keeping the arms straight and not putting too much pressure on that front hand. Then we'll lengthen your knee and straighten the knee into an extended triangle pose. And if you feel comfortable here, you may try and grasp your hands behind your thigh for a deeper stretch. As you release your hands, you'll bring them back into that extended triangle pose. From here, we're slowly going to rotate your torso as you go into a twisted triangle, reaching towards the wall behind you, again lengthening the arms and keeping the back straight. As we come forward, we'll straighten and bring our hands forward and lunge towards that front wall into a warrior one, and step forward as you bring your hands up towards the ceiling. As we move over to the other side, I'll explain why I love certain stretches for hygienists. We start with some breathing exercises and spine lengthening stretches to wake ourselves up for the morning or to decompress your spine after a long day of work. Anyone who sits throughout the day would benefit from these types of spine lengthening stretches. Make sure that as you stretch forward fold that you're lengthening your spine and really benefiting from the deep stretch that you're doing. And then we'll step into your warrior two position where you're able to start stretching the lower back and the abdominal muscles, as well as opening the hips. As you reverse your hands into reverse warrior, again make sure the knee is not coming over the toes, but it's allowing you to stretch the leg without putting too much pressure on that knee. And then you'll rotate your arms down into the triangle. The triangle is the beginning of the stretches that involve your hip flexor muscles, which we use often as you're twisting and turning throughout the day. A very deep stretch, but really wonderful to prevent injury and make sure that we're feeling energized and capable throughout our workday. I especially love when we twist our torso into the twisted triangle, because this really opens your hip flexor muscles up and prepares the back for a day of sitting and twisting and moving positions, trying to be able to see in your patient's mouth without compromising the strength, the flexibility, and the health of your back. And then again, we'll come forward into your warrior one, getting the last little bit of stretch in that leg, and then taking a nice big breath as you step forward. Now we'll move forward to some floor stretches, raising your hands up towards the sky, and then folding into forward fold in preparation to step back into downward dog. In downward dog, it's important to lengthen your spine and raise your hips towards the ceiling. And then we'll come forward into a yoga plank, lowering down in chaturanga. And then inhaling into upward dog, really stretching the spine, stretching the abdominal muscles. And then we'll raise back up and push back into downward dog, pushing your hips back towards the wall behind you, lengthening the spine. Now we'll move through some cat-cow positions. We'll start by arching your back and stretching up as you inhale, and then exhale as you round your spine, which feels so good after a long day of working hygiene. Again, arching your back, fluidly moving between the two positions, and rounding your spine for that release. From this point, let's bring one knee forward and bring it parallel to your arms the best that you can, and get into a really deep stretch, opening that hip flexor, bringing your nose closer to the ground, really enjoying that stretch. And you can rise up as you prepare to change legs. So you'll bring your back leg forward, and again, bringing that calf parallel to those front arms the best that you can for a really deep stretch in that left hip. This really opens the hips with the position that we're working in, helps your flexibility and prevents injury. And we'll rise up again, and you'll swing your legs around and do a similar stretch in a seated position, bringing one ankle on top of the knee and hugging that knee close to your chest. Again, our last chance to open up those hips before or after a day of seeing patients. And then we'll switch sides. Hugging that knee in close to the chest and breathing.